and welcome to Impact's Community Podcast. If you're joining us for the very first time, the purpose of our podcast is a way for our community to come together to discuss various topics that may be healthcare related, questions about how we work as an organization, or anything that we want to highlight that we've been working on that we want to share with you. My name is Dr. Maharaj, and I'm the Medical Director here at Impact Health Sharing. And we have today...
Phil Chrysler, President and CEO of Impact Health Sharing.
All right, Phil, do you want to start off by telling some of those that maybe didn't join us last time what healthcare sharing is?
Sure. You know, and it's, again, in its purest form, right? It's individuals, it's families, it's small businesses coming together that are like-minded and contributing monthly to eligible medical expenses, right? Eligible means what? Well, you go to the guidelines and you find out exactly what you are responsible for, what the community is paying for, right? And so it's completely transparent. It's a not-for-profit approach, which reduces costs, and we do it in a very transparent way with our community, and then also with the ability of connecting everybody on our platform, which is an industry-leading kind of first platform that does all that. So really, that's really in its purest form what Impact Health Sharing and healthcare sharing in general is all about.
All right. And just to touch base a little bit on how we work exactly. You sign up, become a member of Impact Health Sharing. You receive a card in the mail. When you make an appointment to go see your healthcare provider, once you arrive, you present that card to them. On that card, it'll display what your provider fee is. Whether it's primary care or a specialist, that's how much you would pay at the time of your appointment. They will electronically send their bill to us. We review, determine its eligibility, and from there, if you've met your primary responsibility amount, then our members will share in that expense at 90%. So it may...
Yeah, I mean, it works very similar, right, to what you may be used to, but many, in a lot of different ways, much better, right, in that regard. So you get the benefit of repricing, so providers, we're paying fair market value. You get the ability of transparency, right, bills, you don't have to get involved in trying to really inject yourself in that process. Once they're sent to us, we process it, make sure they're eligible, and so I love the works better, feels better aspect of Impact and trying to make that process as member-centric and as simple as possible. And we do that, and we continue to improve upon that with the good work that you and your team do in the billing area. And so, yeah.
Excellent. And speaking of working better, feel better, we're going to be chatting with Pastor Bolden, Dr. Rhonda Bolden, soon. And she has a really unique story. She joined Impact Health Sharing right at our inception. And unfortunately, just a few months later, she developed stage 4 breast cancer. And throughout her entire process, she describes her ease of process with dealing with Impact Health Sharing and her providers. She went, got all the treatment that she needed, and we're happy to report that today she is cancer-free and she has completed her treatment. Again, all of which was shared with our membership. Yeah. So when you talk about feels better, that really has to hit home with that, knowing that your money went towards helping Dr. Bolden get better.
Yeah, in her hour of need, right? The community was there to help her, encourage her, and make sure she wasn't in any financial despair with the with her medical bills, right?
And one of the things that she talked to me about is, you know, obviously you're diagnosed with cancer. It's a stressful time. Yeah. The last thing she wanted to have to worry about was her healthcare bills. And having Impact really eliminated that worry for her and helped her heal and focus her mental health on improving her health. All right, so at our very next podcast, we're going to be hearing more from Dr. Bolden. In the meantime, stay healthy. Until next time.
Take care.
Bye.